Good morning, everyone. Thank you so much for joining us this morning. We are really looking forward to an excellent conversation today about what it means to have cultures that are flourishing and what it means to exist in a flourishing system. So welcome to Mission Transform Medicine. My name is Kamara Ellefson, and I serve as the National Director for Partnerships at the Kern National Network for Caring and Character in Medicine, or the KNN. Before we begin, I do want to take a moment to recognize our ongoing support from the Kern Family Foundation, without whom our work would simply not be possible. I'd also like to note upfront that we are going to be recording the presentation that occurs in the main room today. And then the small group breakouts will not be recorded to allow for a little bit more open dialogue, but wanted to make sure we were really transparent about that with each of you. So for those of you who are not familiar with the KNN, our aspirational goal is to advance caring and character in medicine in order to ignite positive change that helps individuals, community, and society flourish. Working with and across our founding member schools, which you can see here on this slide, as well as many others in the broader health ecosystem, we prioritize three major areas of focus. The first is transforming medical and health professions education. Second, working with healthcare organizations to influence cultures and environments. And third, sharing knowledge and engaging partners towards broader policy and systems change. Today, we are going to focus squarely on influencing cultures and environments, as well as the mindsets or the mental models that underpin them. True flourishing requires positive, supportive environments where learners and practitioners can thrive as they provide equitable, effective care. Each one of us is significantly affected by our environment and the systems in which we work. And we are also actors and agents within those same systems, which means that you have an important voice in shaping culture. And so we are so glad that you are here with us today as we begin this conversation together. This slide is what we call our tree slide, or the KNN integrated framework. And it's our hypothesis on how the interconnected concepts of caring, character, and practical wisdom support human flourishing. The tree as a whole represents the concept of flourishing, highlighting growth and change and development over time. In the leaves, you can see that we recognize that flourishing is not static or a state in which one arrives and somehow stays, but rather it ebbs and flows and evolves over the seasons and chapters of our lives. The concentric rings, the blue rings that you see around the edges, emphasize that these concepts operate at individual, organizational, and societal levels. Now, before we dive into how we create cultures of flourishing, it's important to touch for a moment on what flourishing means and how that can frame our thinking today. Drawing on the work of Vanderweel and Sue, we at the KNN define flourishing as a wholeness of being and doing, of realizing one's potential and helping others do the same. Flourishing can be measured across the domains of happiness, life satisfaction, physical and mental health, meaning and relationships, and is most commonly achieved through pathways of family, work, education, and spiritual community. So at this point, it's natural to wonder, is flourishing really all that different from what we've been hearing about over the past decade? After all, it was nearly that long ago when Dr. Tate Shanafeld sounded the alarm on the need to address physician burnout and improve well-being. Yet here we are today. The National Academy of Medicine and the US Surgeon General just this month have declared physician well-being and burnout a national health crisis. Wellness and well-being are absolutely essential. We can't flourish without them. And that's where many organizations have started their journey and continue to focus, as Kathy will share with us today. However, flourishing, we believe, can offer us a broader picture that also incorporates community and the way that character shapes our approach, not just to ourselves, but to others as well. The involvement of practical wisdom and the intentional choice to shift our mental models. In that way, we believe that flourishing gives us a new aspirational destination, a new course to chart in the health ecosystem. This quote from Tyler Vanderweel of Harvard's Human Flourishing Program emphasizes the power that flourishing has to help us make meaningful progress. So that brings us to the central question. How do we advance cultures of flourishing? Throughout this session, we'll aim to answer that question together, lifting up the factors that contribute to such a culture, considering whether current processes and practices align with this goal, and identifying ways that we can move towards a culture of flourishing in our own unique institutions. To guide us, I can think of no one better equipped than Dr. Kathy Pipas, who has a personal and professional passion for this topic. In addition to her work at Dartmouth and the Geisel School of Medicine, she has chaired related programs and committees at the national level. Her leadership and contributions were instrumental in the creation of the AAMC report, The Rise of Wellness Initiatives in Healthcare, which explores how institutions nationwide rate their progress on addressing the health of care teams throughout the health ecosystem. And so it is my great joy to welcome Dr. Kathy Pipas. Kathy?
Thank you so much. I'm going to share my screen and confirm that everyone can see me, hear me, and see my screen. Excellent. Kamara, thank you. It is such an honor to be able to share what I've learned along my own personal journey towards well-being and this journey to promote and advance a culture of flourishing. I just want to start with this moment of gratitude and reflection and allow each and every one of you to take a moment if you'd like to chat, something that you're grateful for, or if you just want to pause and have a moment to bring yourself to where we are this morning. I'd like to thank KNN for prioritizing this topic. I think my belief is that what we can envision, we can make happen. And so that if each of us can begin to imagine and visualize this state of being where we are all flourishing, not just one, not just some, but all, we can achieve that together. And so today I'm going to begin by giving you a little bit of background, and then I will review the report that Kamar mentioned, exploring those recommendations for how we can do this as a team, as a culture, as an institution, and as a society. And I'll give you an opportunity to each explore your own assessment of where you are as an organization or as a system as you choose to view it. And then lastly, we're going to come together and share some of those promising or best practices that we're all experiencing. So I also, and in the form of gratitude, I want to thank each and every one of you, not just for taking a couple of hours out of your day today, and not just for the care you provide for others, but the care that you take of yourself, because in modeling, we sustain our own well-being and we promote the concept of a flourishing culture. So thank you individually for what you're doing for yourself and for others. I'm going to begin with a few premises. These are the key aspects of the philosophy and the work that I believe, that my own well-being, and I'd like you to all be saying this at the same time, my own well-being is critical to my effectiveness and please fill in the blank, as a mother, as a wife, as a child, as a clinician, as an educator, as a teacher, as a member of society. And once we believe this is not a sense of or a sign of weakness or laziness, that this is really our means of caring for others, then we can begin to thrive and flourish together. The additional premise is that a supportive environment is critical to my well-being. So even with the greatest of skills of resilience, if I'm in an environment that's not supportive or that may even be toxic, I'm not going to be able to flourish. So both of these are combined, are critical to our work. So I'll give you a little bit more background. I know you're familiar with this. This is our message, really, that we're not going to be able to do the work that we aspire to. And we've shown that. We've got the great exodus. We've got all kinds of things working against us. We won't be able to achieve better care, better health, lower costs for our patients and our healthcare systems. And I love Dr. Bodenheimer and Sinsky's message. We will never, ever, 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 ever be able to achieve this if we do so on the backs of health professionals. So we really need to be thinking of ourselves, our own health, and our own health of our care teams. This is just a step backwards for us all to be on the same page and realize where we've been with this epidemic of burnout. Again, beginning way back in 2011, when we started looking at some of this data, we looked at the general population. Their burnout rates were about 30%, 28%, and pretty steady over that period of time. For physicians in this particular study, it was about 45%, but it was rising over that period of time. And the same concepts in satisfaction with work-life balance, the general population being 60% satisfied, but physicians being significantly less and falling. And then we saw the studies that continue to explore students, residents, nurses, clinicians, any aspect of healthcare professionals, and we saw very, very similar results. 2008, we had another publication similar, and we started to see some of these burnout rates go down. We started to see some improvement. We were actually beginning to see some progress. And then, of course, we were hit with a pandemic, 2020. All of our rates continued to increase, higher rates of anxiety, depression, suicide, et cetera. And then we begin to think, okay, so what is the impact? What does this matter? And we know that if I'm burnout, this impacts me, right? I have dissatisfaction, I have a lot of physical, emotional, and I have a lot of high-risk behaviors as well. And so it's not only I'm impacted, we began to see studies showing that my system's impacted. I'm not there, I may be there, absenteeism, presenteeism, but I'm not performing at my highest rate. And it's an extreme cost in recruitment, retention for health professionals in our system. We also see enormous numbers of articles coming out in the literature showing that my burnout is impacting my patients. They're not getting the care they need and their outcomes are suffering. And so you put all of this together with the volume and the imperfect storm that we've been experiencing, we really do have a public health crisis on our hands. And the studies continue to show that we need to address this. This is a wonderful report, 332 pages, but there's a nice mini summary of 3 pages if you want the short version. But basically the message is that we have to approach this from multiple perspectives, that ecological model, the organization, the team, the individual. We have to think of solutions at all of these levels. I love this article, came out recently by Tate Schoenfeld, and it helped me to take a breath, to step back and say, we're doing our work. We don't have to have it all done tomorrow, but he described the history, the eras, if he calls them, of where we are with well-being for physicians over time. And he describes the era of distress, which is everything before 2005. And I think, does that go back as far as Hippocrates? I mean, this is not decades, this is centuries of distress and ignoring some of the issues. And then we entered into what potentially were the most tumultuous or conflictual times where we started to have awareness and people began to talk about these topics. Pandora's box was open. And only now are we enter into this period of action where we can make a difference and we're seeing some results. So I asked the question that Tamara's asked, what does it look like for all of us to flourish in medicine? And what do we begin to imagine? And how would that feel? And how would that appear as we begin to draw it and to imagine it? So I do also go back to this ecological framework. I think this is critical for us. And when we think about well-being, we think about thriving, we think about flourishing, the individual's benefit, the individual's ability to be well enhances the effect on the family, the team, the organization, and the community. And if you flip that over, the community is only able to flourish as much as each and every individual within that organization is able to flourish. And so we really have a continuous ecological framework for all of the work we're considering as we go forward. If we think about a vision such as this, healthy individuals contributing to healthy communities that turn around and prioritize personal system well-being, we will begin to see flourishing at every level. We know that we've not achieved that yet, so we need to also consider, and I love the framework of improvement, whether it's the PDSA cycle or any of the improvement processes, the tools that you use. And then to simplify it, we just think of this in self and system. So how do we begin to continue thinking about our own well-being, our own flourishing, as well as that of all of those that are around us in our system? So let me ask you to step back for a moment and think about what system do you influence? And we'll start with a poll. Just to begin to say, what area do you have the ability to make a difference in? Is it your clinical? And I believe Christine's going to put up our poll. Again, are you influential and able to change at the patient care team? You have a small clinical team, a microsystem, if you will, or is it your educational team that you work in and have most influence? Clinical practice, perhaps it's a leadership group, or maybe you're at the level of being able to change or promote change in the organization, or perhaps in your community or your societal groups. And if everybody would just take a moment, tell us where they're at. Where are you thinking that you can potentially have an influence? So we think about this as we're beginning to assess. I'll also ask you to keep in mind this same system that you're looking at. And I'll ask you to assess that when we go through the recommendations. Excellent. Looks like we've got percentage, and it looks like we've got most people that are thinking educational, and that's consistent with the KNN model. That a lot of you out there are educators, but we've also got a spectrum from patient care to leadership, and some at the organizational level. You might be a chief wellness officer, you might be a director of well-being, or promoting diversity, inclusion in your groups, and working in communities. And if you want to chat what your other is, that's great as well. So I'm going to ask you, in addition, in the chat, to consider, as you think about a flourishing system, and hopefully some of you have been in flourishing systems, many of you may still be just visualizing it. What does that look like? And just in your chat, if you would share one characteristic of what a system looks like when everyone is able to flourish. Empowerment. So again, I'm seeing lots of things are going to come across quickly. I feel safe, right? I'm empowered to speak my voice, and I'm safe. I'm creative. I've got autonomy. I can make some decisions myself. Everyone's included. I love that word, inclusive and empowered. So when you feel like you belong, your voice is heard. When your voice is heard, you're willing to even have conflict in order to make sure that you're included. Communication, inclusivity, we've got lots of themes coming here. I feel valued, I'm connected. Again, when we don't feel included, we disengage, we back away. I'm part of a community, right? So we're in that sense together. I have agency. Thank you, thank you. So lots of comments. Let me flip this over now. And it looks like somebody's already gotten into this hierarchy. What is a characteristic that, again, I know that many of you, myself included, have been in systems where it does not feel like we're flourishing? What does that look like? What is a characteristic of a system where I'm not being encouraged to flourish, or my well-being is not a priority in that group? Blame, okay, so some alienation, absolute distrust. And as a result of that distrust, I don't come to the table. And even if I do come to the table, I may not be speaking. Diminished, disrespectful, some top down, right? So the fear factor is working in there. I'm being potentially bullied or excluded in my thoughts and my comments, condescending, thank you. So, and yes, unfortunately, I'm seeing that all of you have been into environments, and hopefully a balance of both of these so that we can learn from the good as well as from the challenging. So oppression, again, where I've been taught not to speak up. I've been taught not to be creative. And again, we see then that community is not going to include my contributions. And therefore, anyone's contributions are missing. We as a whole do not move forward in the way we can. All things disconnected me from others. Sidelined, thank you. So lots of experience that we've had, unfortunately. And each of your comments are very consistent with some of the literature out there. I'll show a few frameworks. Again, characteristics, we have shared goals. We're all working towards a vision. We're all working towards a common set of commitments and mission. We respect and trust one another. Trust is really highlighted in there, because when we trust, we can move forward with that concept of conflict. We have roles. We know what we're doing. We have clarity in our roles and innovation in our roles. We're welcome to, again, regular efficient meetings. We talk about that as something that we can share ideas, but we can be both efficient and we can be respectful. We welcome ideas, but we don't just talk. We act upon things. These are all opportunities for us to flourish together. We communicate, we give feedback in a respectable way. We achieve our outcomes. We have some rules and we adhere to them as a team. This model particularly comes from the 5 Ps, where we're really thinking about the purpose, the people, the processes, the products, and the policy. Again, another improvement tool that I find very helpful when approaching effective teams. This is another series of literature that shows that when we're achieving the quadruple aim, we have effective teams. So when we're looking at better health, and we've seen this over and over in studies looking at depression, anxiety, when we're doing good teamwork, we can achieve not only the triple aim, but we can absolutely achieve the quadruple aim when we're caring for ourselves. And then lastly, I love this because trust is at the core. It's down there with the vegetables. If you're thinking of a food pyramid, it's really the basis for everything we do, so that if I trust you, I'm going to be able to calmly, respectfully disagree with you. And once I disagree, my voice is heard. I can make a commitment to being at the table. I hold myself accountable, and therefore I'm part of the results achieving. And I always say a quiet boardroom is not an effective boardroom. People probably are not trusting enough to speak up and have conflict. So let me transition for a moment into our report. And this was really an effort, a collaborative of so many individuals. This was a group who really in 2019 wanted to say, hey, what's happening out there? We knew there was a rise. I often called it an explosion, but we chose the word rise for the final publication with the AAMC. But we knew there was a rise. Everybody was trying to make initiatives happen around well-being, around wellness. We also knew that there was a explosion, if you will, about well-being champions, that tag you're it. You know, everybody who expressed an interest, who had a compassion, who had empathy for this not working, rose to the table and was given a charge. And some of those were not as clear. So we really set out with a large group of organizations to try and identify what was happening out there. And leadership from many organizations, probably some of you will see groups that you work within. We piloted it early on throughout some of the family medicine groups that I work with, and we came up with a national survey. And the survey response was pretty broad. We had over 500 responders across institutions, and we were broad in terms of setting, academic health centers, as you can see along here. We were broad with disciplines. We had over 30 disciplines representative, highly primary care, but not just in medicine. We had all health professionals, so it was interprofessional, high levels of females, and then we had broad distribution of age, of title and faculty, and then also of academic ranking. One of the first areas we wanted to identify was what did you have a well-being champion? And what we found was 83% of programs had well-being champions. Roughly 1/3 of the respondents were the champions themselves. So we had a different parallel, a different set of studies of data that we were looking at from the champions themselves. We wanted to know what the champions' titles were, because we chose to use the term well-being champion as a very generic term because we did not have a sense that everybody was a chief wellness officer. And we saw, again, in our study, 10% were chief wellness officers, and then we had a broad distribution of wellness directors and chairs of different departments, as well as almost 30% had their own very unique and creative titles. We had a chief fun officer. We had all kinds of clarity, creativity in what was seen in terms of people's titles at this point. One of the things we also wanted to know was what % of FTE were you getting? And I think this is very telling that almost a quarter of them had absolutely no FTE, no protected time for this position. Very few had over 50%, and those were much more likely to be the chief wellness officers. So we began to see, there's some challenges here, people taking positions without protected time. We also wanted to know about training. What are the training that is happening? And we found that, again, 69% of these individuals who were well-being champions had no training whatsoever. Only 30% had some training. And again, the training was higher if you were more likely to have a title, if you were chief wellness officer, director, or a chair, than if you did not have a title. We then asked about wellness programming, and we found, again, a high percent, almost 90% of programs had something that they identified as wellness programs. And I think we all knew, we were very suspicious at that time, that many of this might be a yoga class at noon on Tuesday, and people were checking the box. But what we discovered was that almost a half had some wellness programming put in, not just for their learners, which is where we all started with ACGME requirements, LCME requirements for our medical students and residents, but also for their faculty and for their staff. But again, only half of programs had all of those areas as audiences for their initial programs. We were really interested in knowing what curricular elements were included in this. So was it just a yoga class? And we began to see some broad areas. We asked this both in a ranking and an open-ended. The top ones, and these are presented in the order of ranking: improvement processes training, resilience training, conflict management training, emotional intelligence training. And we saw that many of these programs were putting them in place in mandatory curriculum. And we assume, again, that's student resident pieces. Some were hoping to add these in the next 12 months, and then a large group that were putting these into optional or extracurricular programming as well. When we asked about the methods, how are these being implemented, we found that there was a combination of optional wellness activities, and then the two that are starred were identified as the most valuable. So many, many different methods: outside speakers, workshops, online modules, wellness communities, mentoring programs, and then this mandatory lecture series, again, mandatory probably mostly for learners, and then some wellness challenges where we're all walking, counting our steps, things like that, and then bringing in some consultants. So those that were identified as not only being utilized, but most valuable were the combination of optional things and mandatory. And we've had a lot of discussions as a result of this data about should these be mandatory and optional. And I think we came up with the conclusion, similar to some of your comments in the chat, that we need to have competency for every single member of our healthcare team, but how you choose that should include autonomy, agency. You should be able to choose what it is that you need for your well-being, your thriving, your flourishing at this moment. This is probably the most creative question that we had. We asked for not only the range of funding, but we asked for the philosophy of funding, and we got some amazing comments. Again, very few have budgets. Those that do were most likely to be chief wellness officers. I think 5% had budgets of 50,000 or more. But we also found that, again, this concept of you can have funding if you demonstrate a return on investment. So long-term impact will get you some short-term funding. Or again, this is an unfunded mandate. You can spend as much as you need to. This is a priority or great idea, but no budget. So a large variation in how they were funded and how their philosophy of funding occurred. We also wanted to know what programs had a vision and actual goals, how much of this had trickled up to the top of the organization. And what we see here is very interesting in that institutions that had a chief wellness officer, which are in blue, were the most likely to have a vision, 77%, and a set of goals. Those that had a wellness champion, but not at the organizational level, we called it at the embedded level, somewhere in the institution, were less likely, but still more likely than those institutions that had no well-being champions whatsoever. And again, there's not a cause and effect here. We wonder, is it the chief wellness officers or the well-being champions that then drive an institution to actually create a vision and set goals at the organizational level? Or is it that an organization has done that and then they name a well-being champion, a chief wellness officer? Again, I think there's lots of discussions to be had in this, but the two are certainly correlating. We also asked about evaluation and found that only 30% of programs actually had any kind of results or outcomes, studied whether their programs were making a difference. And certainly that was higher in those that had an organizational level champion, and then lower as those champions were either embedded or not present at all. Also, very interested in knowing how many were measuring well-being, not just measuring the impact of their programs, the interventions, evaluation, but only 40% actually had metrics. And again, these were more likely to be doing metrics at the organizational level around individual well-being if there was a chief wellness officer or an organizational level champion, less likely if they were not, and even less likely if they had no well-being champions at all. So just in summary of the survey, before I get into the recommendations, we see that well-being champions and wellness programs are a new major position across all disciplines, all type of healthcare organizations, probably even more common than our program directors or clerkship directors are. But we're seeing similarities in their urgency and in their need for curricular elements, for methods, for delivery, but we're seeing an enormous amount of variation in their titles, their training, the tools they have at their access, resources, budget, metrics, outcomes, as well as publications. In the report, there are a series of appendices where you can see all the metrics that individuals used. You can see all of the resources they had at their fingertips, both locally and nationally. So there's a great set of resources in this 60-page report if you haven't seen it. And the resources continue to expand. So national resources are out there for everyone with articles, references, starting to say what are some best practices and promising practices. But we believe there's an opportunity for us to standardize, to collaborate, to determine and to disseminate our best practices. And again, I'm very grateful for this opportunity today for us to continue this journey, advancing our flourishing in this area. We know that this efforts that we take will not only benefit our wellness champions, which we can't afford to burn out our champions, right? We need them. They're taking on a huge responsibility. We can't afford to burn out healthcare professionals, healthcare systems, and we know that our work will benefit society as well based on the impact data. So what I'm going to do now is I'm going to share with you the recommendations, and what I'd like you to do, most of you are probably familiar with a SWOT, and you don't need any fancy tools, but if you would take a piece of paper or a tablet or however you'd like to record, and think about the system that you identify, the system where you have influence, where you're able to organize and maybe make a difference. And as I go through each recommendation, I'd like you to consider, what is the strength? What are the things that your organization is already doing very, very well? And those are the ones we're going to share when we go into small group as well. But what are some weaknesses? What are areas that, you know what, that's a great opportunity for improvement. That's how I view the term weakness in that quadrant. And then opportunities is also something that, and I believe in my interpretation, it's something that excites you. It's like, wow, we have all the pieces. We just haven't put that cake together, and we get excited. What would be an opportunity for you? And then threats are the areas that, I'm not going there. We haven't touched, but if we don't touch, they may actually be to our demise. They may really limit our ability to flourish as a whole. And so as you begin to think about these, I'd like you to put each of the recommendations in one of these 4 quadrants for the system that you participate or have influence over. So these recommendations begin with this acknowledgement that what we have currently is not working, right? It's a complex issue. We need to approach it with an improvement framework, right? We need to begin to be open to change, do a needs assessment, ask a lot of hard questions, and then be willing to have this open mindset to be able to make changes as we go forward. And to what degree does your institution embrace that already? They have improvement, experts in the area, and people are trained in those models of PDSA and processes. So again, you'll place the word improvement framework in one of your 4 quadrants: strengths, weaknesses, opportunities, or threats, in terms of where your organization is currently. Number 2 is really this idea of an organizational vision. And again, as we saw, that they're more likely to have a vision if they have wellness champions at the organizational level. But to what degree is your organization's vision clear, articulate, and on the tips of everyone's tongue? Do you know what your organization's vision is for well-being? And is it something that's broadcasted as opposed to, our previous dean used to say, not to put it on a shelf, but to live it every day? Number 3 is, to what degree does your institution have a commitment to organizational level well-being champions? And this champion is someone who helps to set that vision, helps to set those organizational goals, but serves as a glue or a networking, a link between the well-being champions that are at the front line. So this person has an overall responsibility for well-being, not just within one division, one department, one audience, but really looks at it from a comprehensive way. And then 4th, to what degree are the champions also embedded? And we find this to be even as critical as the organizational level, because it needs to represent the voice of the front line. So someone at the clinical level, someone at the medical student level, someone at the Department of Pediatrics level, so that at many levels there are embedded champions that can speak to the needs of that particular audience. Number 5 is, and I find this to be so common, so important, but so basic: to what degree are the job characteristics or the job description of these champions clear? Do they know what their expectations are? How often do we sign on, yes, I'll do that, but we don't have a clear job description? And so to what degree, and again, you may not have all this information, but is the role of that champion, and whether you're that champion or you're just understanding that champion's role, very clear to everyone, both that person as well as the organization members? Do you know your champion, and do you know what they are responsible for? And then consistent with that is, to what degree is that role supported? Do they have training, resources, dedicated funding, and time so that they can succeed in their work? And we know that these are all critical to any role that we play. Number 7 is, to what degree is well-being a core competency? Do you have well-being initiatives, not just for your learners, which in many areas has caused a little bit of resentment among faculty or clinicians who are doing more for others, but haven't had that prioritization of flourishing for themselves? And so to what degree is well-being a core competency, or at least a committed core competency for all of the health professionals, staff included, in your system? And then next is, to what degree do you study what you do, right? Evaluating the interventions that you're putting in place so that you know if what you're doing is going to make a difference, and then you can prepare to publish it and disseminate it across institutions. The next is around our individual well-being. So we can say, yes, our program is great. We were able to teach about emotional intelligence, but to what degree do we know that it's making a difference, the so what question, and that my well-being is benefited, that we're not just doing great knowledge, skills, and attitude, but we're also improving well-being. And again, in the words of K&N, that we're all flourishing. And how do we begin to measure that? And I'm looking to you, Kamari, as you're nodding your head, to be thinking about what's the next flourishing survey that we need, right? What does that mean? And then lastly, and this to me, I think was most disappointing in this survey, but most exciting as we move forward, well-being must be reinforced, recognized, and rewarded. Only 9% of institutions had well-being or flourishing, if you will, as part of a professional development goal or assessment on a dashboard. So the majority of ways that we're evaluated have nothing to do with how we're sustaining or modeling these healthy practices. It's really about, again, our ability to contribute or do RVUs, again, things that are not prioritized in this strategy. So if we have this as a vision, to what degree does your institution value this, recognize it, reward it, discuss it with individuals along their professional development goals? So I'm going to take a moment and step back and ask each and every one of you to just spend a few minutes analyzing your SWOT. And you've got these 10. And again, as I think about how I've done this and begun to think about my institution and the areas that I've worked in, we have great QI frameworks. And we have wonderful, we've even called them quality improvement pros, lots of people trained to do quality improvement. We have those at so many different locations, frontline, big picture. And so that's it's a great ability for us to build on these recommendations. But that organizational well-being champion is really not necessarily serving as the glue. That's something that we could improve. And we have this opportunity for a vision to be more succinct, more articulate, more lived. And I think some of the threats are certainly being able to support these champions and make sure that we have them embedded at every level, not just a few levels, but all of the levels, all the audiences that matter, which in the words of all means everyone. And so these are things that we think about as we're starting to put together in the text or context of the first and improvement process. So as you think about your own SWOT, what % of the recommendations do you believe are currently activated at your organization or whatever system you chose to look at? What %? Nothing? Not at all? Up to 30%, 60%, 90%? Or is there someone out there that has all of these recommendations activated? And I can tell you, I've been working since this report was released, and in the end of 2021, we've done quite a few workshops with organizations and have found only 2 that have listed as 100%. And again, they interpreted it activated. They're not 100% complete, but the majority were only in the 30% or less. And many programs said, geez, we haven't even started this work. So I'm interested in seeing where we fall as a group of advanced leaders in these areas. These are educators. These are, groups that have prioritized these topics for our learners and hopefully for ourselves. So what % of the recommendations are activated in your system, your area of focus? Just take a moment. Get my chat up as well. And those 10 are in. Thank you, Christine. The 10 recommendations are embedded in the chat as well if you're needing a refresher. We won't put you on the spot here if you're 100%, although I might just stop talking and let you take over if you're there. All right, so we're consistent about 30%, 10 to 30%, the majority. We didn't have anyone in the 100, I'm sorry to say, but I love the concept of room for improvement, right? So we've all got room for improvement. And it looks like everyone has begun, except maybe 10% of us have not begun, but you've got the world, the world at your fingertips in terms of being able to start. And the one caveat I'll add at this point is that this is not in a particular order, because many will say to me, well, where do I start, right? Do I go to number 1 or do I go to number 9? And I can tell you that there is no literature at the moment that says these have to go, but I go back to some of the wonderful articles, even Cotter, about, setting urgency, setting a vision, that if you have a vision, and I believe that, to me, the vision starts with an improvement process framework. So there is some belief that, yes, you have to think of it as something you can change in order to envision the change. And then you do have to set a vision so that everybody's working in the same page because we are so busy and have so limited resources. There's not a way to do that many opportunities. And so this has to be a priority at your organization for some of the other recommendations to occur. So what we'd like to do at this point is we'd like to hear from all of you. And we're going to break up into small groups. And we'd love for each of you in the next 30 minutes to share, again, introduce yourself, your role, your institution, but to share a strength. And we want to hear a little bit of detail. What is a strength that your organization is doing well? And it could be a promising practice, or it could be a best practice. It could be published, or it could be just in the works, an intervention that's happening that you believe is advancing this culture of flourishing. We have facilitators in each of your groups. So we'll be in small groups and probably be somewhere between 4 and 6 members in the group. We're going to give everyone an opportunity to speak because we want to hear from all of you, even if there's, if you're in the 10% that has none of these as strengths, there's or recommendations as strengths, there's probably still something that you believe is happening well. And so we want to focus on that appreciative inquiry. What is it that you're doing well in your organization that we can begin to disseminate to others? And then we'll come back in large groups, and Kamara and I will come together and we'll listen to you. We'll hear through your facilitators some of the pearls that you can share with us, and we'll debrief some of the learnings. So I am going to turn over to Christine, who will do the magic and put us into small groups. And I appreciate your sharing, and I look forward to hearing some of your learnings. Welcome back, everyone. I am very excited to hear all of your stories. I'm making my screen much larger so I can see more of your faces. You're all very small. We're going to ask our committed facilitators to share some of the highlights. And as we're pulling Joelle up, I'd love to start with her, but I'll continue to share some of my own stories. I think one of my favorites over the time that I've been working with different organizations is a group that is now putting into place stay interviews and stay bonuses. So rather than exit interviews, when someone is dissatisfied and has exited the healthcare system, we're meeting with them on a regular basis and asking them, why are you staying? What's going well? And we're giving them retention bonuses as opposed to just sign-on bonuses, and then allowing them to go somewhere else where they may earn a little bit more money, but they're retraining, they're restarting. So that's one of my favorites. I'm like, wow, we should all be doing that. So I'm very excited to hear from all of you, and I appreciate your sharing. Joelle, do you want to represent your team and tell us either some themes or some examples of what you heard?
Sure, absolutely. And as I just said to them, when I'm done, I'll call them in case I've missed anything. So our conversation on the strengths aspect from the recommendations, one thing we talked about is seeing commitments in creating physical spaces and practices where well-being and flourishing can happen. So specifically, word that stuck out to me is that we have this beautiful space that we can go to engage in this way. So there's just almost like a physical feltness of the commitment. And then, you can also access the resources in other ways. So virtually by phone, 24/7. But there's definitely that there is space and money being put into that by some of our organizations. We also talked about how well-being was being taken seriously. So understanding it from a philosophical level and going beyond yoga, diet, sleep to really try to unpack it and then to work on it from that vantage point. We also shared that there was definitely visibility in terms of the embedding of well-being champions within the various business units. And this flow of information that goes in all the directions was what I love to hear, right? So it's not just that here's the information I got about well-being and I give it to you, but the information flows back from what the needs are kind of on the ground and goes back to be dealt with by the sort of higher level. The last question that came up from our group that I will just throw out is that this idea of, are we skipping a step if we don't talk about what it means to be human before we talk about well-being and flourishing? And I'll pause there and let any member of my group jump in.
You hit, Joelle, on some of my favorite topics. Again, that idea of taking off this badge of superhuman and allowing the human badge to replace it, to have empathy, compassion for ourselves, the same that we do for our patients, no more, no less. I also love your space concept, because I think it gets to the idea that, you know, there's a lot of literature on nature therapy and having beautiful environments. We do better post-op if we have a window, right? Very simple things. And so many of us don't even get outside for, you know, sometimes the entire light part of the day. I also appreciate the importance of transparency, because so many institutions say, you know, I've been surveyed, you know, so many times, survey fatigue, but nobody ever tells us what the results are. We know they're bad, but we're not talking about it. And even if we do see the results, we're not seeing any change. And therefore, who cares about the surveys? I'm not going to bother answering them, or I'm not going to bother answering them honestly. And so that cycle of feedback has to continue in order for us to show that there is trust amongst our participants who are taking the time to complete surveys. Anyone else from Joelle's team that wants to share their pearl or lesson learned? Thank you. Alverno, please, will you share or represent your team?
Okay, wonderful. Thank you. Tara and I were both in and with our group, and some really interesting conversation was had. I thought it was really robust and insightful. So we learned that assessing the individual well-being of students is one of the things that was taking place using AAMC, the Y2 survey, which is a really great way to start to understand what the student experience is versus what the physician or practitioner experience is, and then tailoring well-being services to that population. So understanding the difference within our constituency of who needs well-being at different dimensions or at intervals where we can intervene. And so starting to find out through surveying what are appropriate steps to be taken. So not just having general programming there, hoping that people engage it, but actually finding out what people are asking for. And then also we had a guest in our sessions who talked about using media to stir innate and intrinsic sharing. So using adding media into the spaces and engaging through other ways, so creative ways of engaging people to find out how they can be helped, what is it that they are interested in. And so again, not looking at it as a one size fits all, here's a program, here are some activities, but engaging them where they are, okay? And which I thought was very innovative. And then also having well-funded and embedded as culture, you know, in other words, designing your own well-being. So we had a guest from ACP, American College of Physicians, and they have created a website where you can go to learn how to start your own wellness program, or well-being program rather. And a really comprehensive website where I've already been through it, like a quick perusal. And it's a really great tool that helps people to learn how they can create programming if they don't have any. So if they're starting from zero, they could actually learn how to implement something that would be a starting space and a foundation for well-being at their institution. We also talked about the importance for the success of programs being dependent on the level of support and effort put forth by the leaders of the organization. And so having overarching vision and overall strategy, change management, all of those pieces that need to come from the top of the organization, as far as not just buy-in, but setting the example, setting the tone, and then appointing an officer, and a structure to that, to show intention and importance, value to the rest of the organization, came out as a thought as well. And so one final statement that was made, and I thought was fantastic, is that there are people that love their jobs, and that their goal for well-being or work-life balance isn't to be away from their job, but it's to be recognized that I love what I do, and I love being of service to people. I love touching and changing lives. And so work-life balance is this understanding that wellness needs to happen at work. So someone can be working really hard and lots of hours, but they're loving what they're doing. And so we need to consider that work-life balance is more than, hey, I don't want to be at work, which we all love. I think someone said, we all love time away, but there are people who love being at work when they're there and engaging and doing what they do. And so, so we do need to capture within divisions, within pockets of our organization, whether it's hospitalists or practitioners or it's students or administrators, what work-life balance means to them, and tailor our programming appropriately.
I love, excuse me, I love the messages, Alverno. I love the concept of story. And I've seen so many schools that are now presenting stories, both my story of burnout as well as my story of joy. And those two stories can be really powerful. Schools that have done this in narrative writing and narrative things, but also in visuals and poetry and sculpture, all different ways of creatively sharing story. I also, I find your message of ask. When people say, okay, if I'm starting, I don't even know where to start. And I say, don't jump in and do an intervention, ask, right? And you highlight that, ask people what they need. I say, go to your group. And I'm chairing a Physician Health First program where we're training in the leadership, the leading physician well-being, where we've got 130 physicians across the nation that are training as well-being champions. And they all want to say, what do I do for my project? And I say, go in with the learning mode and ask people for a quick survey. What are the top 3 challenges they face? And their 3 ideas on how to fix it. And you will find enough material to get an effective intervention by listening to the team. And as you highlighted so eloquently, one size doesn't fit all, right? And unless we hear from the individual we're trying to help, we can't tailor our interventions to them. So we want to have it as individualized as possible. I love your group's messages.
Thank you. Did anyone else from our group have anything that I missed or that you would like to share that's just like burning in your heart right now? Would be glad to hear that. And Tara, if I missed anything, please feel free to jump in.
Awesome. Thank you.
Thank you all.
Thank you so much. Let's hear from Julie and her team.
Good morning, everyone. We had a great discussion in our group, and I'll invite anyone to unmute as well. Without duplicating what we've heard from our first 2 groups, I'll just give you kind of a quick summary. We all had quite a bit in common. 3 of the 4 schools that were represented in our group have chief wellness officers and frameworks and and all of that in place. But how that kind of plays down into the departments and the different sections of the hospitals and the medical schools tends to be a little bit more unsupported and untrained. And so those were really some opportunities that we talked about, and funding those down at the department level people and getting them trained so that everything is where it could be as far as tying back up to the framework and engaging with that chief wellness officer. One of the schools has a curriculum for students on well-being that is required within the curriculum, and another school that is their opportunity right now. They are revising their curriculum and hoping to put in some well-being initiatives there. Let's see. One of our schools really has more just kind of unofficially seated wellness champions throughout the organization. And so their opportunity is really to get some C-suite support and even maybe even assessing cultural readiness. And we took some time in talking about, when you see somebody who's burned out, what do you do? And we talked a little bit about, could there be, toolkits or workshops on like how to talk to a colleague or a student on getting them to the right help that they need in that moment, and kind of building that army or so from the bottom up rather than working from the top down. And I'll stop there and invite anyone else from my group to add to that.
I love your team's ideas, both in curriculum training and recognition. I think that we've all looked to organizations like ACGME, LCME to be a little more scriptive of what we need to teach and what we need to train. And in the past, to be a well-being champion or need to have well-being curriculum. And that was it. That was the degree. And I think that this next month, July, coming up very soon, there are going to be more details coming out, including recognizing, as you mentioned, we have to be able to recognize it, because the literature shows no matter how much training we have, we certainly don't recognize it in ourselves. And then what do we do, right? So recognition and next steps actions. And so I think those are going to be some of the critical pieces. I work with a lot of organizations, and that was why we asked about curricular components that do training in all of those areas we talked about: cognitive reframing, emotional intelligence, conflict management, lots of different areas. One of the value many groups have been seeing is not just doing it for their students, but doing it in interprofessional and interinstitutional ways. And we're beginning to put together some of those monthly workshops where students from across institutions and faculty across, within an institution and their students can have these conversations. So, we know that you need great tools so that everybody can learn the skills and the strategies, but then sometimes it makes us feel alone, right? So I'm struggling, and I'm alone in that struggling. Whereas when I come together and I share my vulnerability, particularly if I'm a faculty and the students think that we're all wonderful and perfect, and we're not, and we're going to acknowledge that, there's a strength in that community of learners. So we've done a little bit of learning on our own, and then we come together and we share those in an interprofessional and an interinstitutional, if that's a word, we have the IPII workshops now that we're putting together for these strategies so that our learning can be across communities. And I think that's really how we break down these barriers of stigma that we've had for so long. Anyone else from Julia's team that wants to jump in? All right, excellent. Thank you so much. And Sarah, please share from your group.
Absolutely. So we had a thoughtful conversation as well, and I see a lot of resonance with some of the themes that have come up in other groups as well. But to touch on some of the key points, we talked a lot about getting started and then scaling across the organization. So for organizations just getting started, one approach that was shared was conducting a survey using the burnout measures, resilience measures as that starting point. I think the unique or especially helpful angle there was, just like you mentioned, taking an interprofessional lens. So including faculty, clinicians, staff, nursing, basic science, and making sure that all of those different voices are captured. That really led into a conversation similar to what Alverno described about the importance of tailoring and individualizing initiatives or programs to pursue. So the survey is a great starting point to get some initial ideas, and also can help with that need to prove the need for investment in this area, kind of establish that there is opportunity or ROI here. But then the group also indicated in some cases, one of the organizations is going to be doing one-on-one interviews with faculty who volunteered for that, to really understand what they mean and think of when they hear wellness and well-being and flourishing. These standardized initiatives, or Yoga Tuesday, is very kind of across the board, and approaches to flourishing can't be. One tip for doing that I thought would be helpful to share with the group is one of our group members indicated it can be effective that when you're asking people about their challenges and concerns, especially in a group setting, it can be helpful to set the expectation that you're asking each of them to bring a concern or issue and a possible solution, recognizing that they won't necessarily be able to come up with the end-all be-all solution on its own. But that helped create some psychological safety in the group to have individuals be able to put forward ideas or bring possible solutions without feeling like it reflects on them, or that they need something or may appear weak. So just an interesting approach to kind of facilitating better discussion in a group setting. And then I think finally the two last points that came up is, one was the importance of making sure you have a really strong recognition program. because if you don't have those strong, authentic connections with leadership and you don't feel valued, then programming can come across and feel really inauthentic, or like a Band-Aid if you don't have that meaningful, trusting relationship. So the idea that recognition and staff feeling valued is so intertwined with this was a great point made. And then the last key theme was this idea of for organizations with embedded wellness champions in different areas or layers, creating an overarching group that brings them together at that organizational level, so that they have a community of individuals to share ideas with and greater visibility and sway within the organization as a group than they would as individuals. Those were the key themes, but I welcome anyone from our group to chime in with other thoughts as well.
Sarah and team, thank you. So many ideas that you made me think about, where do we start? We have to model ourselves, right? But there's nothing more powerful for all of you who are well-being champions, whether you're a chief wellness officer or you're representing a frontline or an embedded group. There's nothing more powerful for you to have than, a list of the challenges that your audience has. And if you have to go up, and often you will be presenting in a elevator speech way, it's got to be quick, it's got to be concise to the leadership that will be granting you funding, time, resources, pilot money, et cetera, a list of their challenges. I'd say the only thing more potent than that is actually having the C-suite in the room when the audience, the participants, the healthcare professionals are speaking about their challenges. Now that's tricky, but it can be an extremely powerful. I've seen some, again, you have to have a dean or a president who's very willing to listen and not feel attacked, and a facilitator who can allow that trust, but there's nothing more powerful than an individual being heard at that level. It sometimes can be extremely fiery before, but I think it is also part of that healing process for people to be able to say no. And I've seen tears come down. I've seen residents and I've seen faculty who have cried at meetings, and the leaders are like, wow, I had no idea. And people to say things like, I have given so much, I have nothing left to give. And these are people who came on with such power and such engagement, such enthusiasm as caring providers. And those words, if they can come out of someone's mouth and be heard, those are more powerful than any return on investment proposal you can put together. So again, if you have that capability to at least gather their input, and if you can allow them to tell their stories themselves, it can be an extremely potent way of building your team, building your initiatives. And I love just looking at the chat too, and I'm going to turn over to Kamara in just a second. I think, we mentioned the well-being dimensions, again, the 8 dimensions, and again, that concept of surveying people. And we're not just saying, what's your BMI, what's your blood pressure, what's your stress levels, but, what's your social well-being, what's your financial well-being, what's your environmental, all of the different aspects of the well-being. And that goes along with the concept of flourishing. We're not just talking about our sleep, eating, and exercise. We're talking about us in a holistic, comprehensive way. And so most of the organizations that I work with are beginning to view that. I mean, again, as a family physician, that has always been our approach, as preventative and holistic. And we have to think of our own well-being in that way, very similar to what we do for our patients. No more, no less, right? All right, Kamara, please represent your team. What are some of the strategies and strengths they have?
Sure, I would be happy to. And again, like all others, I will welcome any voices from my team if there's anything that I may have missed. So we had a really interesting conversation. The few things that I think rise to the top that are maybe in addition to what we've already heard was one of our schools is really started a very small, like a micro grant program, $1,000 to an individual to implement a well-being practice or program that they have found to be incredibly successful. And I just thought that was a really interesting idea. One of the things that participant just stressed was that, this has provided opportunities for people that would not normally get those opportunities. So in their words, these were kind of the non-titled folks within their institution that had an opportunity to start to move forward and do some things in their spheres of influence. And they're beginning to see some impact of that. There was also then someone from a newer medical school that talked about the unique opportunity that they have to get junior faculty involved in curriculum development and decisions that are being made at the school, and that opportunity to get those voices involved early on. And then another was really this ability to notice this as a result of COVID, was this opportunity now for individuals to take more mental health days and be honest about that's what they were taking and what they needed, and not a lot of questions or probing that perhaps was in existence prior to COVID. So starting to get a little bit more safety around that. And then one thing that I just would want to add that we talked about at the end that was really interesting was the power of partnerships, and this idea of really thinking about how we leverage other leaders and organizations and centers or institutes within our institutions, much like we have seen with the power of equity, diversity, and inclusion work, and starting to understand it's the work of all of us, not just a chief diversity officer. And the same thing really needing to be important as we think about well-being and flourishing, that it's not just the responsibility of one, but rather something that needs to become part of the organization. So really nice thoughts around partnerships. So would anyone else in my group like to add anything? Okay.
Tamara, I love the, excuse me, the link between diversity, equity, inclusion, and we're finding, again, these two themes, if you will, have risen because of the imperfect storm of COVID. It has escalated the importance of both of them. And I think what we're seeing is that these are tapestries, that well-being of all is very much connected, if you will, to the sense of, do you feel like you're included and you belong and you're treated equally? And I think we're seeing the literature is going to show more and more of lack of belonging and lack of well-being completely linked. I also appreciate you highlighting some of the policies that need to be reviewed. And so within your institution, there are probably some policies that are actually detrimental to people's flourishing. And to go in and find some of those, I worked with a group just recently who had a policy that they needed. It was a community group, but they didn't have CME time. They had vacation time to go to a CME training. And so they were offering wonderful programs, but nobody was coming, right? And so in addition to the regional and the local, we also have state policies, right? And a lot of licensing is being reviewed to say, how stigmatized are we going to be legally if we're reporting and we're getting help? And so I think looking at policies is a critical aspect of our ability to move forward. If we have policies that are actually fighting us, we're never going to advance. So I think, we've got the full spectrum, and I love that, that 5 Ps wheel, because we can think about, do we have a clear purpose? Who are the people we're trying to serve? What are the processes that we're doing? What are the policies that we have? And what are the products, the outcomes that we want to achieve? So I think there's so many different ways for us to begin this effort. We don't have to, and I love that, again, that new article from Schonefeld is, we're just beginning. So don't feel like anybody's behind the wheel. Don't feel like there's nowhere to go because it's so high up, that everything that we do is going to advance our culture in a way to move us forward. We have lots of room for improvement, right?
Lots of opportunity.
Any other thoughts there? I also noted in the chat, again, this concept of science and stories. And as I began my own journey in this area, and to tell my own story, I remember I was at Dartmouth. I had finished an MPH, which was, again, the way at Dartmouth of getting all of the wonderful training. I was serving as chief clinical officer. I was the vice chair. I was the director of our regional primary care. I had way too many hats. And I remember sitting in graduation with my classmates who were students at this point, as opposed to where I typically sat with faculty. And I was listening to the speaker, and you've all heard this speech in graduation, go forth, change the world, cure cancer, do it all. And I was thinking of my own life, and I was looking around at my peers and saying, we're not eating well, we're not exercising, we're not taking care of ourselves. Many of us are taking medications we'd hope to prescribe only for others. And it dawned on me, what about us? And I love that song by Pink, What About Us? And it changed my whole focus over the last decade plus, that I've now been prioritizing well-being for health professionals as opposed to patients, and thinking about the stories that I've learned from people. And I began doing more and more research on the evidence-based strategies, and I put those together. And that's how people say, when did you have time to write a book? It was really curriculum. I was teaching well-being, I was researching well-being, and I was learning from other people. And so my own story comes out in the book that I wrote, A Doctor's Dozen, 12 Strategies for Personal Well-Being and Creating Cultures. Again, the idea that stories can be so powerful. You know, we learn from the good, we learn from the bad, but that's the way everybody wants to learn, case-based learning. You know, tell a story and connect to an individual, and then give me the data, right? Give me the literature as well. And then let me have an exercise that I can apply my learnings. And so as good educators, you know, pedagogical importance, we want to incorporate science and stories and then application. So I welcome and invite a continuation along those areas. Maybe tomorrow, as we start to think about next steps, we want to maybe throw out a few questions for all of you. You know, what can we do as individuals to promote, you know, flourishing at our own institutions on a national level, on a global level even, and particularly what can KNN, and I know, you know, Tamara and others are very eager to hear your thoughts on that. And we can probably, again, maybe even turn the slide off and have a little bit of a discussion in this area, welcoming any of your ideas. Are there some things that you would like to see happen on a more of a national level, or regional level, or state level, or an interprofessional, interinstitutional level? As a community, what can we do? Welcome your thoughts on chat, or just unmute yourself, raise your hand, jump in. I think I would thank you, Kamara and KNN, because I think having these discussions, when people say, where do I start? This is always the place to begin. Like, just open up the floor and see what comes out. If this was this was a wish basket, what would you ask for, Rebecca?
Hi there. This is related to the conversation I had in our breakout room, but I also heard someone make a comment earlier about kind of creating those safe environments, psychological safety. I just finished my dissertation on fostering group level and organizational level compassion in healthcare. And so I think a really important piece of a well-being conversation is, how do we create safe spaces in organizations for people to be able to recognize, relate, and react to each other's pain? Because I think sometimes people's definition of wellness is, how can I equip myself to be resilient? And that can almost be toxic depending on how the messages are being pushed out towards people. Like, you need to be really positive, and here are the tools that you can manage on your own. But I would love to see more attention. And I'm hoping to build a program of research on this, on how people can co-construct meanings of what it means to help people and emotionally recognize, and then meaningfully react when you notice that someone is burnt out. Like, how do you start those conversations? And then how do you kind of create the contagion of compassion in the workplace?
Yeah, there's so much now resisting that resilience term and embracing that compassion term. And I think it goes to the ideas, we don't want to be Teflon, right? We don't want to be superhuman. We want to be human. We want to feel the things that we have suppressed. And I'm speaking for myself here, for so long, right? I'm not hungry. I'm not tired. I'm not sad. I'm not even joyous, right? I can be numb, and I can do that for such a long period of time until I can't do it any longer, right? And I welcome your research. I welcome you to explore ways for us to not shame one another for experiencing emotions and sharing and embracing those emotions, whether it's in a classroom setting, in a clinic setting, when somebody is having an emotional experience, to embrace that and deal with it, as opposed to shutting them down, shutting ourselves down, shaming ourselves. And it's not something we were trained. So I think it takes retraining, right? There's an enormous amount of emotional intelligence training happening, because unless we do it with ourselves first, it's very difficult to do it for others.
Yeah, I think it'll take a lot of script breaking.
Yes, exactly. Right. That I'm fine. And I think that's one of the ways I've heard people stop to do it is in that we had in the chat earlier, that common language. So how are you? I'm fine. How are you? I'm fine. How are you? I'm fine. If we can break that cycle and not even ask, how are you, unless you really have the time to pause and find out how someone is, and then to really answer authentically and genuinely and from the heart. It's a practice, just like medicine, it takes lots of practice and time, but that's a great example. Any other examples of how people can embrace emotion when they start to see it? Particularly in our students. Oh my gosh, students come in, and the literature we have is students come in much better in all areas of quality of life than what happens to them literally the day they enter our culture. What is it in the water? And some of my students have said, not enough SSRIs. And I say, oof, I hope that's not the answer, right? You don't need an antidepressant to come to medical school, but how do we keep you feeling, right? How do we keep you embracing where you are as a human so that you can enter relationships with that human quality? Who's found some successes out there in that area?
I've definitely found success in child and adolescent psychiatry. And so often, I think the medical model of teaching to this day is asking like, what's wrong, and asking your chief complaint. That's how we write your notes. That's how we introduce the patient. So-and-so is a patient with these problems. We never really go to talk about their strengths or explore it or go beyond kind of fixing the disease or whatever is coming towards us. And so instead of doing that, I'm teaching our students how to recognize strengths and start with a strengths-based approach in interview. And within that, they're getting a more human side of our patients and recognizing that, but also it just like bolsters their own well-being. They're more excited with the work they're doing and with what they can offer and the tools. And that's been really effective in our work.
Christy, I love that. And it's also how we're paid, right? We're paid because people are sick. I mean, there's a few payment models that are changing from that, but for the most part, we get paid. So how do we use those skills we know are evidence-based for well-being? And as you say, appreciative inquiry, right? What is this person doing well? It also reframes their life. So it helps to cognitively reframe where they are. They may have rheumatoid arthritis, but they're still attending all of their children's games, right? So they're able to do many, many things despite some setbacks. And I think that's a really powerful. I'm not surprised that child and adolescent psychiatry is where this is going to grow from. Thank you. Other successes? David, is your hand up?
Yeah, I don't have a success yet to report, but it's just an understanding, and it relates, I think, to Rebecca's comment also. Our society at large, never mind healthcare, is plagued by stress, right? From a variety of sources. And stress then has lots of different consequences. And without launching into a lecture on how it changes how people think and behave and problem solve and the willingness to help others, it all feeds into it. So when I looked at your question as what is needed at a local, national, global level, it's really a way of helping people diminish the impact of their stressors, because stuff goes wrong, and the ego story gets in the way. And so when we live in a hyper competitive, narcissistic, individualistic culture, and that's just said matter-of-factly, that is amplified on a daily basis. And all of these things cause stress and polarization and fractionation. And then you add that and a caregiver comes to work to try to provide for their patients and is bearing that, and the patients are coming into the room also bearing that. So I see it as a much larger problem. Since we have at least one psychologist, maybe more, on the call, from my understanding, I'm an endocrinologist, I only play psychologist on Zoom, is positive interpersonal connection has been written about multiple times to promote to resilience and buffer stress. And so if we're talking about a low-cost way, then the messaging of where people feel connected to others, where they have community, where they have support, so it's not running to put out a fire as much is it goes into more of a preventive mode rather than a interventional mode. And so, and then there are ways I think of doing that, but it depends on the organization. I have my own, biases about them, but no success stories to then provide yet.
No,
So
I love
it's not there.
I absolutely agree. There's a book I just mentioned in the chat, Steve Southwick, and he's done a lot of work on resilience and studied. He's a professor at Yale, studied prisoners of war, special task force members, and victims of trauma in the emergency room at Yale. He's a psychiatrist, and he would say the same thing, that stress levels are up in everyone. There's some people that he chose to study those with the highest levels of extreme trauma and stress. And found that there were factors that help them to manage these. And so how do we manage our stress? How do we, and we know, as you said, we have, an overload of work and an under workforce, right? So we're constantly going to be in stress. And on top of that, COVID has presented more stress to our patients. So every person that we're interacting with throughout the day has higher levels of stress than they had 2 years ago, right? That is a universal global, phenomenon right now. So how do we learn? How do we practice replenishing ourselves every day, right? And we can't just hop on a plane and go to Mexico once a month, but can we learn mini vacations? Can we learn ways of bringing our stress levels down? And I love those curves that say, we get high stress and we perform better to a point, right? And then we start to fall off the curve of performance when the stress is chronic and it's maintained. So how do we get ourselves to come down, replenish, and then go back up so that we perform high and then we replenish and then we perform? And again, that's what we haven't learned well as health professionals. We've learned to perform high, but you can only stay at that level for so long. It's not sustainable for an entire career. And unfortunately, that's what we're seeing. So yes, I would say, to answer the original question, Kamara, if we were to say what kinds of things can KNN and others do, is stress management, right? So both on the individual and the cultural level, how do we begin to, learn these skills and encourage and not shame others for not doing them, but to promote those types of behaviors, so that we don't, everybody has to manage stress some way. We don't turn to alcohol. We don't turn to, depression, suicide, other things that are not healthy. Any other thoughts, please, David?
Well, just to extend it to your point, it actually witnessing incivility. This is something that startled me when I learned it not too long ago. That just witnessing it, not being the object of it, is enough to cause physicians to fail. In this case, anesthesiology residents, to fail a simulated surgery. From their pass rates go from 91% to 64%. And they don't want to talk to the rude surgeon. They don't want to order blood, so patients dropping their blood pressure. It's amazing from this brief encounter, and there's an entire literature about this. So the effort, even though it sounds daunting, if you think about the knock-on effects of diminishing the burden of stress that people in general have to shoulder, the implications are huge.
No, you're absolutely right. And to at least tell us that it's not a deficit in our own competency to be experiencing whatever it is we're experiencing when we have stress, because then we don't go inside and just shame ourselves and come into that cycle of guilt that prevents us from using the cognitive brain, because we're in that, hijack of our limbics, right? And then we're frozen, we're in fight or flight mode all the time, and everything shuts down. We're not creative, we're not thoughtful, we're not problem solvers. So yes, we do need to verbalize those experiences, and your story, is the way to begin doing those, taking those stories of, the literature, taking the stories of individuals, and allowing people to process it, and to build skills, and then to support one another in an educational, and as we said, in a safe place, can be really powerful.
Sure. And we do it through media that it's not exactly stories, but it's depictions and representations of related concepts of kindness and caring and
Cases.
connection, which induce, just like images of food and drink, induce these innate qualities with reward center activation. It's a partially endorphin-driven process. But yeah, we need solutions, a group of solutions. But I think if we think more generally, then it addresses a whole host of social problems.
I think that, Kamara, it's a perfect transition for you to be thinking, because I think, the C's of KNN are the perfect opportunity to be able to address all of these, and both competence care, all of those areas allow us that framework for moving this forward to a flourishing environment. I'm excited to be part of it. I think we're grateful. We're thinking about what are some of the continued opportunities that we can share, and how can we continue to contribute. And I think Christine may have one more slide there. And Kamara, I'll let you do a transition and closing words. Thank you all.
Thank you. Thank you, Kathy. Great appreciation to all that you have brought to us today, and the way that you facilitated our own creativity and our own energy in terms of starting to think through these things. This has been really, really great time, and thanks to all of you that have participated as well. The name of our gathering is Mission Transform Medicine, and that was very intentional on our part. Thanks to Sarah Williams for her creativity in coming up with that, speaking of creativity and energy, because we really are talking about a transformational movement. And that type of transformation will take all of you. We had a very exciting announcement last week at the KNN that we have received another round of funding to keep the work going. And so when we ask the question, what do you think the KNN can do? We really are interested in finding out. We are dedicated to the transformation of cultures within medicine and the healthcare ecosystem towards this idea of flourishing. And so would encourage you to continue to put ideas into the chat. We've heard some amazing things from the conversation. I know one of the other things that I will just throw out is that, we talked a lot about the ability to measure the impact, and that right now there are a lot of perhaps individual measurement tools or things that might measure an individual's well-being, but thinking about what opportunities would there be to think about how we measure the impact within the system and within the institutions and organizations as another thing that we could focus on. So we do look forward to hearing from you. We hope that you will stay connected to the work that we are doing, even as we move into our next phase, where there will be robust opportunities for you to join in the work of the KNN and join us in some of the new initiatives that we'll have moving forward that are informed by sessions like this, where you are answering the question of what can we do and what needs to be done, and allowing us to move forward in that form, because we had this beautiful conversation about strengths and what's going well. And we know that underneath that, there are a number of things that still need improvement. And Kathy's data showed that to us as well. And so hopefully a conversation like today is inspiring and moves us towards a greater place of action. And we know it's something that will take all of us working together. It isn't something that can just be the work of the KNN, but rather the KNN hopes to be a type of network of networks, a movement that enables us to all have a platform that we need to continue to move things forward. So this is what we too believe. Kathy, thank you for bringing it back to our framework. This is why we do believe that a framework for flourishing is so important, and that all of those aspects, as we think about a wholeness of being, are what is going to be really important for us as we continue on this journey. So as I mentioned, we do want to continue to hear from you in terms of your ideas, resources. We will collect all of the amazing resources that you all have shared in the chat today as well, and send that out to you in a follow-up email, an opportunity to continue to explore what's out there. You can get in touch with us at the KNN directly, or even Dr. Pipas and the work that she does. If you're interested in continuing to be involved in this, we certainly want to hear from you around questions or suggestions. And finally, My hope would be that you can prioritize and celebrate moments of flourishing in your own lives and in others. Kathy talked about Cotter's model, the Heath brothers in their book, Switch. They talk a lot about the elephant in the rider and the necessity for influencers and leaders to walk the talk. And if you were to ask me in a moment where I think some of the greatest impact could occur, I would suggest it is with those of us who are leading within this health ecosystem. If we are not modeling this and showing this as an institutional value and a personal value, makes it very difficult for the people around us to get on board, because as leaders, we send all sorts of unintentional and very compelling messages through the way that we behave. And so my hope is that you all will be able to prioritize this, to celebrate this, and to think about how you can even begin just in a small way to bring moments of flourishing to the spaces that you have influence on today. So again, thank you for taking the time to be part of this important conversation and helping us think about how we continue to move this forward to action and really transforming medicine. I also do just want to, again, take a moment to pause and extend our thanks to Kathy, to all of the facilitators, to each of you, and of course, the incredible generosity of the Current Family Foundation that, again, is making conversations like this possible. So please keep in touch with us. Let's transform together, and may your day and your week and your month be full of flourishing. Thank you, everyone.